Yes, sir, I am.
All right, folks, we're back live here with our Meet the Candidates virtual session. We are still in District 97. We're joined now by Miss Ruby Powell-Dennis, a candidate there for the Democratic primary. Ruby, thank you for joining us tonight.
My pleasure. Thank you for having me.
Just a quick reminder for those listening in, if you have questions, feel free to type them into the Q&A box. And if there's time at the end of our interview, we'll be sure to ask those. We have 3 questions to ask Ruby, and then we'll give her some time at the end to talk about any other issues she wants to discuss with us tonight. So Ruby, we're going to go ahead and get started. Our first question is surrounding scope of practice. So Governor Lee recently issued Executive Order number 15. Among the provisions in that order were the ability for nurse practitioners to practice with autonomy. So what's your position on the expansion of scope of practice for non-physician providers such as nurse practitioners and physician assistants?
So I've had some pretty long conversations with my healthcare policy lead, who is a board certified emergency room physician, just about scope of practice. And my sister is also a nurse. So ultimately my stance on it is that, you know, we need physicians go through quite a bit of schooling, quite a bit of preparation. And while, you know, nurse practitioners and other healthcare providers do provide an essential service and play an essential role in our healthcare services, I think that, you know, there are some things that need to be left to, you know, physicians who've been through medical school that can see the nuance in a patient's, you know, symptoms that might just because they've had more education. And so I believe that we need to make investments in expanding physician training programs in our state and doubling down on just having more full-on doctors coming out of med school who are serving our communities.
All right, great. So jumping right on into the next question, there's a lot of difficult decisions being made today that force our business owners, parents, policymakers, I mean, all of us, to balance personal physical health and even the health of a community with economic health and that desire to get back to business. It's a common phrase we're hearing nowadays. Can you talk about your thought process when faced with those similar challenges if you're elected?
Yes. So as I shared, my sister is a nurse. She is actually nursing on the front lines and has been serving COVID-19 patients since all of this began. And like I said, I've talked extensively with those who are on the front lines. I think that we have to proceed with a level of caution. That'll be always my recommendation. This is a global pandemic. There is no business as usual. You know, viruses, I mean, this is sweeping the planet. And so there is no back to business. Instead, we have to operate with putting the safety of our communities first. That means that we'll have to think about, well, what do we need to do without until this moment in time subsides? Because at the end of the day, I care about human life, all human life. And so we have to put the lives of those who are serving in healthcare every day on the front lines. You matter to us. And so I want to proceed with caution and not get back to business as usual, not super quickly.
Great. So kind of staying on the economic front, you know, inevitably as the pandemic has shown us, we're going to be faced with some economic challenges, revenue decreases, most notably at the state level. When talking through cuts, how do you prioritize, and will you, and if so, how, cut healthcare spending?
So, I mean, the first thing that I need to say is that we need to expand affordable healthcare for our state. You know, every opportunity that we have to better serve West Tennesseans and their needs, especially during a pandemic, we need to be doing just that. I feel like that's my role and that's my calling. So I do believe we need to be doing everything we can to expand affordable healthcare. The other part of it is that so I have an MBA. I've worked with multi-million-dollar budgets. I helped open a school and a school district here. So I know what it's like to have to make really tough decisions when all of the people in front of you are in need. And so the way I have always approached it is, one, we have to think about what is going to take care of people. And so people's lives, their safety, that matters. But also we have to be very smart about the money that we do have. So there are instances where, you know, $41 million is going to vouchers. And so there are probably some line items as we go through our state's budget where we can simply reallocate funds because the needs in our community are different. And so we need to move money around so it better meets the needs of West Tennesseans, including, of course, providing more funding because this COVID-19, this pandemic is not going to go away. We need to have longer term solutions in place. And again, I'm partnering with healthcare providers like yourself to better understand what that looks like. Because again, we shouldn't just write policy because it sounds good on paper, but we need policy, healthcare policy that saves lives and that puts people first.
Okay. So we want to allow for some time here for you to address any other issues. You're welcome to expand on any of your healthcare positions, or if you want to talk about other issues, here's your time to speak in general to our physician population.
Certainly. So I have a lot of friends who've gone through med school who are now, you know, in their 15th year of practice. And so I care a lot about like the cultural elements of what it means to be a strong quality, high quality healthcare provider. And so we have communities in our county that are, you know, have healthcare disparities. And so we're having conversations about what does that mean? What does support look like? And so I'm just so appreciative of all of the, you know, folks who not only just practice medicine and take care of all of us, but also do it from a place of understanding the underlying conditions that are impacting people all across this county. And so I am thankful for, you know, the work that you do. I want to make sure that I am always a champion for healthcare providers. Like I said, you know, issues around healthcare are near and dear to me. I lost both of my parents. My father was a veteran, so I know what it's like to be a family member spending lots of time in a veteran's hospital. My mother was a school teacher. I know what it's like to see someone in a high stress profession who never smoked nor drank. And she ended up on dialysis the last 10 years of her life. And so I understand the impact of stress, the impact of underlying health conditions on different people in our city. And so I just commit to advocating for just that nuanced healthcare that takes care of people very holistically.
Well, that sounds great, Ruby, and thank you for that candor and those words about our healthcare professionals. I know it's appreciated. We can never hear that too often these days, even, you know, it seems like you see it every day, but it always helps to hear it. So thank you for that. And thank you for joining us tonight. That concludes our interview. Good luck to you on the campaign trail, and we hope to see you down the road. Have a good evening.
Yes, the pleasure's mine. Take care. Stay safe.
All right, you too.